Thank you everyone for joining us. This is a quick update on whole body plethysmography. That's this machine here, over here, and the computer, also known as the Brachybox. I've been meaning to do this for some time to let everyone know that the Brachybox is now working very well and that we use it nearly every day for measuring patients' upper airway function. Now, this has only been possible because of initially the French Bulldog Club of New South Wales doing a fundraiser to raise money to buy the box. Their raised money was matched by Dogs Australia, and so together they raised enough money to purchase the Brachybox. This is a very technical machine. It's taken nearly a year to get it to work properly. And special thanks to Clara, who's one of our emergency clinicians who spent many hours on Zoom meetings with technicians in the UK to essentially teach us how to get meaningful readings. And a very special thanks to the British Bulldog Club of Victoria, who also fundraised money so that we could bring the technician out from the UK to Australia to repair the machine because it had been damaged, and also to calibrate and show Clara and myself how to use it. Now the box is ventilated so that he can breathe just fine, and it's cool. A reality of this apparatus is it is so sensitive that the dogs have to stay still and they have to have a respiratory rate that's less than 20 breaths per minute. If they move in the box, if they're panting in the box, it can't measure their upper airway resistance. So Colin is a very good boy. And what we can see here is it's starting to document his respiratory function as he breathes in and out. So when it goes red, they're traces that can be recorded. So what we'll do is we'll actually measure Colin. So we're entering him in. He has an Irish spelling for his name, and I can't spell it, so he's getting the Australian version. Colin, you're a big beefy boy, 17 kilos. Okay. All right, so Colin's now decided to lie down, and he's nice and still. We will need to wait a moment while the machine starts to read his respiratory patterns, which is happening here. Now we need 20 traces in total in order to determine his BOAS index. And the BOAS index is a measure of his upper airway function. We've now selected 20 respiratory cycles or breaths in and out. And essentially in Colin's case, his measurement is most consistent with a grade 1, so a dog with mild brachycephalic obstructive airway disease or syndrome. So the higher the number amongst these 4 grades is where he falls, but his BOAS index is 0.53. So a dog with a BOAS index less than 0.5 is a dog with very mild or no brachycephalic obstructive airway syndrome, whereas a dog with a BOAS index that's in the region of 0.8 to 0.9 is a dog with severe brachycephalic obstructive airway syndrome. Now, obviously Colin's been fantastic. Not all dogs will tolerate the box, so we can't use it in every patient. It's also really important to mention that this is a machine that gives us an indication of the severity of the dog's disease. But like all tests in medical practice, it needs to be interpreted carefully. It's never used in isolation. In a clinical setting, we always take a comprehensive history to determine what the dog's lifestyle is at home and what problems they're having associated with their airway obstruction. We'll put them in the box, the whole body plethysmography, to obtain an objective data measurement as to the extent of their airway obstruction. But we'll always also take them outside and do a respiratory functional grade to actually evaluate the dogs in a functional format after they've been trotting for 3 minutes. So we certainly wouldn't give advice just based on the dogs going into the whole body plethysmography. The real strength of the box though is really those dogs that have already had surgery that are not doing so well and we're trying to work out, do they still have significant upper airway obstruction? The other real value of the box is, of course, for the non-clinical environment. So there's been a lot of work done now in the breeding community with the respiratory functional grading, and the uptake's been fantastic. Hundreds of dogs have been evaluated now, and breeding programs have been modified, selecting for those dogs that don't have bias. But if we have a dog where the respiratory functional grade has been a little ambiguous, or we're not completely convinced it's correct, we can put those dogs into the box and evaluate them and produce our bias index, which is then an objective assessment rather than a subjective assessment. So respiratory functional grade in combination with a whole body plethysmography gives us a really accurate assessment of airway function. So it's a two-tiered tool, but what's very exciting for me is how we've been able to use this in daily practice in our process of evaluating bulldogs to work out whether or not they require surgical intervention or medical management.